How's it going, guys? It is 3:26 a.m. Thursday, May 26th here in Japan, and we have a medium difficulty question for family medicine / neuro for 2CK. A nearly identical question shows up on one of the new 2CK nbme forms. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. The links to the Telegram group and channel are down below. Now let's start the clip. 69-year-old guy, 2-week history of pain radiating down his right leg. Treatment with oxycodone acetaminophen has not been sufficient. He has a long-standing history of type 2 diabetes mellitus managed with insulin. There's no recent trauma. Physical exam shows hyperesthesia to touch over the right leg. Muscle strength and sensation are intact. Question just wants to know the most appropriate next step of management. Obviously, this is diabetic neuropathic pain. Okay, painful diabetic neuropathy. Let's just walk through the answer choices here. Choice A, increased dose of oxycodone acetaminophen tablets. Wrong fucking answer. Okay, I don't know what to tell you. It's just what they put this on the nbme exam, and it's the wrong fucking answer. Choice B, discontinue oxycodone acetaminophen, add fentanyl. Just another nitpicky distractor. Okay, when you're not sure, you say, well, that sounds very specific. Maybe it's right, it's not. And there's no specific indication that I've seen for fentanyl on nbme exams either. You just need to know fentanyl is a strong opioid. Okay, and when patients are when patients have pain that is refractory or non-responsive to other pain meds first, fentanyl is sort of a last resort because it's very powerful. Wrong fucking answer. Choice C, adloperamide. Wrong answer. Albeit this is exceedingly high yield that you know. This is a mu opioid receptor agonist used for diarrhea, predominant IBS, irritable bowel syndrome. Okay, so opioids cause constipation, but that's a quote unquote good thing when we're treating diarrhea, predominant IBS. High yield agent here that you know this. Choice D, admipyridine. Wrong answer. Very similar to fentanyl. Okay, I mean, it's just another strong opioid med that there's no role in terms of adding it to a patient who's already on oxycodone acetaminophen. This is mehlmanmedical is a USMLE favorite for malingering for whatever fucking reason. Okay, on psych forms, they'll say like 42-year-old dude comes into emergency requesting mehlmanmedical for pain. Okay, so highly addicting on the street. Wrong fucking answer. Choice E, naproxen. Wrong answer. Obviously an NSAID. This is a long discussion in and of itself. Okay, the effects on the kidney. USMLE loves this drug. Causes fluid retention, peripheral edema, and kills the kidneys. Okay, so a long discussion as far as naproxen is concerned, but we don't simply add an NSAID in this case. The correct answer is add nortriptyline at bedtime. This is literally the answer on the nbme form. So what they want, and this is what they say in the explanation, is that for neuropathic pain, diabetic or not, we often will try oxycodone acetaminophen first. That's what they say. And if that doesn't work, if that's insufficient, we can add a TCA. All right. So what I can tell you why they choose nortriptyline here is because this is a TCA that has fewer anticholinergic side effects. This is what we prefer to use in elderly if we use a TCA. All right. And I've seen this on family med forms more than once. They'll say 82-year-old guy, he has diabetic neuropathic pain managed with gabapentin and carbamazepine. That combination makes no fucking sense, but it's what they say on the form. And they say, well, what are we going to do because it's not working? And the answer is add nortriptyline. Okay, so when we talk about TCAs like amitriptyline, have anticholinergic side effects, the opposite of dumbbells. Okay, I'm not going to go into the step one-ish stuff right now, but first generation H1 blockers, i.e. diphenhydramine, chlorphenamine, TCAs, amitriptyline, and then antipsychotic medications, all anticholinergic, and you need to be very mindful of using those, particularly in elderly. Okay, cognitive dysfunction, urinary retention. Okay, we don't want to use TCAs in elderly if at all possible, but if we do, we'll use nortriptyline. Okay, this is for diabetic neuropathic pain and just general neuropathic pain, and it's used after oxycodone acetaminophen is not sufficient. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.